All right, guys. Well, welcome on here tonight. And those of you that got to celebrate spring break last week, welcome back to reality, right? So, want to go through a couple of testings. So, if you guys have been on the webinar before, you know how we always like to just do some tech troubleshooting here really quick to make sure everybody can see and hear me. So, for those of you that have access to the chat box, if you can hear me, please type yes in there. If not, you can use the raise your hand app. But yeah, if you can hear me and see me, let's just say if you can hear me, go ahead and type yes or raise your hand there. Perfect, thank you. All right. And then if you can see and hear me, type yes or raise your hand. Okay, perfect. I think we're ready to roll here. So, a couple of things about tonight. I'm going to share my screen so we can get started. So for those of you that don't know me, I'm Dr. Rachel Hutchison, and so I'm a chiropractor here in Florida. And so chiropractor by trade, I do have numerous hours in functional medicine training, is that I've just found has been a huge need for that, especially in today's world. I mean, goodness, there are so many advanced autoimmune conditions and just congestions in general, and people just need other options besides just loading up with drugs. And so this gives us a natural way to be able to help alleviate things, a lot of things. And tonight in particular, we're going to be talking about how to alleviate pain. So let's go ahead and get this thing going. So I'm going to share my screen here. Fingers crossed that this is going to be working for us. All right, so that looks good. And then real quick, so if you guys can see my screen here, if you want to give me a little hand raise and just so you can see, it should be a red image that says Advanced Pain Relief Workshop. So if you guys can see that, go ahead and raise your hand there. All right, perfect. Thank you. You guys are on top of it tonight. I'll tell you what. So let's go through this. So pain, obviously in our brick and mortar office. So our office here in Mary Esther, for those of you guys that are seeing us for chiropractic, I mean, pain is something that a lot of y'all started to come see us for. That is the main reason that brought you to our office. And we've been working with that diligently with each one of you on alleviating your pain, whether it's headache, some back pain, neck pain. Some of you guys have got some pretty wicked headaches that we're dealing with sometimes, in some cases, even migraines. And we're also seeing a lot more joint conditions. We always have, but now it's just a whole new level since we've doing some tissue regenerative therapy in our office, which we'll talk a bit about tonight as well, specifically for those of you guys that have some advanced joint conditions, like a lot of chronic, let's say shoulder, knee, elbow, wrist pain, plantar fasciitis, these sorts of things. And so, hey, technology has come a really long way, and I'm glad that we're seeing a lot more holistic and natural options too that work with the natural design of your body. That always, Mother Nature always trumps everything, in my opinion. So let's go through the beginning here. So, you know, I always like to keep things really basic in the beginning, you know, really just understanding the basic concepts of, you know, just all things health related. So again, tonight we're talking about pain. So what is pain? I mean, nobody likes pain. It doesn't feel good, especially, you know, if it's chronic, when it just doesn't seem like it wants to go away. So all pain is, and I want you guys to remember this, it's just basically like an alarm signal going off in your body telling you that something is wrong. That's all it is, okay? And you need your brain to be able to interpret that. So, and pain can be in many different forms. It can be something like a prick, a tingle, a sting, a burn, an ache, dull or sharp, even throbbing, radiating. I've heard all these types of explanations of this in our clinic. Pain a lot of times can be acute or chronic. Acute meaning that, hey, it just started. It's only been there for a few days or maybe a week or two. Chronic is unfortunately what a lot of you guys are dealing with on here tonight. And that's, you know, the chronic back pain, chronic neck pain, chronic all over body pain. Just, it seems like any given day, some joint is hurting or bothering you. And so tonight we're going to be able to help figure out why that's happening. And that's always the biggest thing, is why. So if you have a health problem, why? If you've got pain, why? If you get migraine headaches, why? If you have digestive problems, why? As opposed to just taking medication to mask the symptom and then just keep on trucking. Like that's the worst way to go about resolving a problem. And then pain, all it is a symptom. It's just how your body is perceiving something to be in your body. And unfortunately, you know, pain is not one of those comfortable type symptoms. So Let's go through some dangers of a really common way that we handle pain in the US here. So if if any of you guys out there are still watching regular cable television, I feel like regular cable TV is becoming a lost art nowadays. It's probably a good thing. But one thing about cable television that made me turn it off years ago was, first of all, I feel like everything on there is negative. But the other thing is, all of the TV shows are constantly interrupted with commercials, particularly that for some kind of new drug or medication, right? And so the interesting thing about when you listen to any kind of drug commercial is the first few seconds they'll talk about what the drug is for, but then the remainder of the time they're having to list off all the potential side effects that they've seen with these medications. And so the thing is they paint this funny picture of like this beautiful, young, healthy family, and everybody seems to be super happy and attractive and in good shape. And then at the same time, they're mentioning may cause stroke, heart attack, sudden death, right? It's a very weird thing. So brainwashing at its finest. Now, long-term pain medication, which is typically, unfortunately, how a lot of people deal with pain, is just by taking medication. Maybe it starts off with something like an ibuprofen or an Aleve, and when that stops working, because the real reason of why the pain's there, the cause of the problems, nobody ever took the time to figure that out. Unfortunately, the body now is requiring more and more of the medication. It stops losing its effect. So here, in my opinion, what I found to be the biggest dangers of taking any kind of long-term pain medication, even if it's something over the counter. First of all, first and foremost, is as long as you're taking that pain medication and that's the only way that you're handling the pain, you're ignoring the true cause of the problem. So what if, for example, you had chronic, let's just say, back pain, and all you did was kept taking ibuprofen, but never really looked into what was causing the problem. And then we later learned out that you had bone cancer. That wouldn't be a good thing, right? So because we would want to make sure we get on top of something like bone cancer immediately. We don't want to waste any time with, letting it fester and worsen inside of us. So that's the first thing. The other thing is that it increases the risk of major health problems. So pain medication, even especially stuff like NSAID drugs, which is the most common over-the-counter medication people use for pain, it is extremely hard on your liver, but particularly your kidneys. And so these people that you hear about having to go into kidney failure and go on dialysis machines, a good portion of these people were from long-term abuse of ibuprofen. It's a slippery slope as to what abuse, taking too much really is. It also, these NSAID drugs erode the lining of your gastrointestinal system. So, which of course leads to the next thing, ulcers and addiction. So not necessarily with the over-the-counter stuff, but like opioids, narcotics, those higher potent pain medications, which unfortunately a lot of people have to graduate to. Those things, are more of an addictive type of thing. And that's where you probably realize that your primary care doctor's gotten a lot more strict on just freely prescribing you those pain medications, even more so now. And that's because, they found that they are addictive. And so their governing boards have really cracked down on them as far as not being able to just prescribe that to anyone and to everyone, and to be, really tight with that prescription. The other thing with not only pain medication, but all medications that you may be taking, is that it strips nutrients from your body. So for example, I'm going to go through specific different medications people use for pain in just a minute on this really cool chart that I'm going to show you, that will talk to you about which medication strips certain nutrients. So for example, just about all medications, all of them that you take, strip some degree of magnesium from your body. So why is this a problem? First of all, we need magnesium for just about every biochemical reaction or physiological process that happens in our body. The main role of magnesium is actually to act as your body's natural muscle relaxer. So our body's always producing chemicals depending on the state of the body and maybe some repairs that need to happen and just for normal function. And so it's basically, we have our own natural pharmacy inside of us. But the problem is when we're taking medications, we're stripping nutrients from the body, or if you don't have a good, healthy diet that's providing nutrients, we're going to miss it that way. So the thing is most medications are going to strip magnesium. And in my opinion, this has led to a huge increase with people just experiencing chronic pain syndromes. And that's because of most people nowadays, they take some kind of medication. I mean, most kids now are on medication, at least I think they said 50% of children now on some kind of medication. And typically it's either for allergies or asthma or ADD, ADHD. And I see this all the time in our practice. So let's talk about specifically when it comes to medications that you may be using for pain, what kind of nutrients these deplete. So if we look here on the left side, you'll see the different drugs listed, and on the right side, you're going to see the nutrients that they strip, with the underlying understanding that magnesium, in addition to these nutrients, just about every medication also strips magnesium or depletes magnesium from the body. So let's look at, America's favorite: ibuprofen, Advil, Motrin, Aleve, Midol, for those of you that suffer from menstrual pain or cramping with menstrual cycles. So it's going to strip B9, so type of B vitamin, vitamin C, iron, and zinc. So a lot of times I'll find that certain patients are anemic or iron deficient, and their doctors are trying to figure out, like, we don't know why this patient is anemic. We don't understand why they're having all these other issues, being, iron deficient. Well, I'm like, well, have you looked at how much NSAIDs this patient's taking? It's amazing how many times I come across this type of thing. So let me ask you another question. If you take NSAIDs regularly, so any of those NSAIDs that are listed there, what do you think is going to happen to your immune system if your body's chronically being stripped of vitamin C and vitamin zinc? See, one thing, there's always everything that you do has some kind of effect. Like, it's a ripple effect. It leads to this, but then also this and that. And so you can't just put something in your body and it not have some kind of effect. I hope that makes sense. So then there's aspirin. That's been around for years and years and years. It strips B9, C, vitamin K, right? That's one of the ways that it thins your blood. Vitamin K is your body's natural coagulator or blood clotter. It's what stops the bleeding. And so if you're deficient in that, that's how they create the thinning effect with the daily aspirin. So iron, potassium, zinc. So definitely when somebody's depleted of potassium, you can also have a host of other problems, muscle cramping, things like that. Is just one of many. Acetaminophen, so this is your Tylenol group, B9, C, iron, potassium, and CoQ10. So CoQ10 is also really depleted with taking statin drugs or cholesterol lowering drugs. And this is a big problem because this is where any drug that acts on the liver is going to potentially affect the production of CoQ10. CoQ10 is like basically your body's it's what makes your body produce ATP. It's your main energy source. And so this is where all healthy body function comes from and repair. So you definitely don't want to be taking any of this stuff long term. All that to say that one of the biggest things or concepts I want you to get when we talk about medication is that, a lot of times people think that as chiropractors that we are anti-drug, like we're so against the drugs. It's actually not true. What we are anti is not getting to the root cause of your health problem, whatever it is. That's all we're about. And since the spine and nervous system controls everything, that's the main system. It's the only system that literally controls everything. It's like the breaker box in your house. We got to make sure all those breakers are on, because if not, your body cannot, your house cannot, your home cannot function how it was designed. Same thing with your body. We got to make sure that nervous system is on. Everything in there is working and firing correctly. And so, but because we've got so much training with the nutrition and lifestyle, we're able to also, in addition to correcting the nervous system and providing good, proper spinal hygiene, that we can now fill in those other things other basics, the foundational blocks that you need to be healthy and to heal. And that's lifestyle and nutrition, right? And just understanding one of the biggest things that I learned in chiropractic school that I didn't know I was going to learn is that it really, really shows you, and this is the only profession I've seen do this, exactly how the body works. It makes you have a deep and great understanding and respect for the human body, its intelligence, and that just trusting in that it always knows what to do as long as you're giving it what it needs and there's no interference in that system. So medication, there's a time and place for that. If it's an emergency, if you need surgery, if you have a heart attack, an alligator bites your arm off, don't come see me. You need to go see your medical doctor. You're definitely gonna need some drugs in that situation, right? If anything, to get the relief that you need, to go through the surgeries and probably what's gonna need to come, the necessary steps are gonna have to happen after that. However, for that you also want to make sure, like in everyday health conditions, to figure out what's causing it. So if you do have pain, we want to know what's causing it. We don't want to just mask it with a symptom and let the problem still fester in there, right? So medication is just there for temporary relief while you simultaneously take a deep dive into what's causing the problem and doing your due diligence with that, both as the patient and the doctor. So I'm going to go back to that. So what I'd encourage you guys to do right now is just take a screenshot. For those of you guys that know how to do that, if you're watching this on your phone or your computer, take a screenshot, because this is going to be something to have handy. And I show this to you because if you're taking, so that you can, like, let's say right now you're taking an NSAID drug regularly, then you might want to make sure you're taking these supplements every day until you get off those NSAID drugs, right? Because it could be causing you health problems downstream. And then you can do the same with the others if you're taking the others. Awesome. So let's go through some really important concepts with pain. Again, the pain is just a symptom. It's something that, your body's expressing, just let you know that, hey, there's a problem. It's basically an alarm signal going off. Now, when you have pain, here's some things that you can do. So there's some general rules of thumb when treating pain. And again, we're going to be keeping this really basic for tonight so that everybody can immediately use these. So if you ever have a new onset of pain, like all of a sudden your back just started hurting, and all of a sudden, you fell down a stair onto your shoulder, now your shoulder hurts, those kind of things, any type of new onset of pain, for the first 2 to 3 days, you only want to use ice. Don't use heat in this situation. And this is because typically with trauma, like that, you're going to get swelling. The swelling can start to compress nerves, and we could start to have some problems with that. And plus, it's just uncomfortable. So use ice. That will minimize the swelling, okay? If you cut your finger, again, onset, something like that, ice is good because it will narrow the vessels and stop the bleeding. So this is 48, for the first 2 to 3 days, or 48 to 72 hours, you only want to use ice. After that, if the pain's still persisting, you can switch to heat. So what does heat do? So heat actually dilates the blood vessels so that you can pull more oxygen to your blood into the damaged area, so you can drive new healthy blood flow in there for repair, because with that, it's going to be bringing all types of blood cells and materials that you need to help repair the damage there. Also, if you've got, and that's one of the reasons that, with if something's tight or stiff, typically heat is also a better option to do, unless the tightness or the stiffness just started. So those are some rules. Now, if you're somebody that's in a chronic state of pain, typically heat is better. And then you can combine that with some stretching and strengthening exercises. So one thing that's important to know, and you might want to write this down because I meant to make the edits this morning and didn't get a minute. So there's something called contrast therapy. So this is something that in the physical therapy world, or even anybody that works with soft tissue like we do, you're going to want to make sure that you're aware that you can also use another technique called contrast therapy. And this is alternating between ice and heat. And so you always want to finish with the heat. So let's say that, and I actually like this for if you use ice and that doesn't work, and then you use heat and you feel like that didn't help, then usually this last thing, the contrast therapy, or the going back and forth between ice and heat, typically is going to get the job done at that point in time. Just give you another option to do. So let me explain how this works. So using the ice, okay, it's going to basically stop the inflammation. And then we're using the heat, then it'll vasodilate or dilate the blood vessels so we can get new blood flow into the tissue, and then we can get some relaxation there. So it's just, you can go back and forth if you've got more of a chronic condition, but the basic rule of thumb is new injury, only using ice and ice only for the first 2 to 3 days. After that, you can move to heat. If you still have a lot of swelling in the area, if swelling something that came up with a new injury, you might want to just still continue using the ice beyond the 2 to 3 days if the swelling is still persisting, right? So that's something that, because I know a lot of people, they never know whether to use ice or heat, so they end up doing nothing when they hurt themselves. And so you can really minimize a lot of your discomfort just by knowing the basic rules there. Okay, So I hope that makes sense. So this is this is a fun part of tonight, if you guys aren't having enough fun already, right? So the natural painkillers, there are so many things you can take or do that don't put any medications into your body, therefore minimizing any side effects or long-term risks that are natural. So let's talk about what these are. So turmeric. So many of you guys are probably hearing more and more about turmeric. This is a great natural anti-inflammatory. And again, if you've been on our vitamins and supplements virtual health class, you know I talk a lot about quality and then also dosing. You want to make sure you get the dosing right with even natural products, because first of all, I want to make sure you're getting enough of what you need for your body weight and your size, but also you want to make sure you're not getting too much, right? So turmeric is good. CBD oil. This is the cannabidiol. So this is the stuff that you guys are hearing more and more about now. And of course, there's medical marijuana. That if you get the medical marijuana card, that's something that you can use too. The only problem is a lot of that stuff's got THC in it. And so, you know, if you need to drive your car, get yourself to work, that kind of stuff, you really have to kind of be strategic about the timing in which you take it. The CBD oil is also very effective, but you don't have to, it doesn't have any THC. So you can just go about your day without any kind of, you know, interruptions with that. So I will say this with the CBD oil, you want to make sure you're using between like at least 1,000 milligrams. That to me, I've got a salve that I use. I can help you guys get get some access to this good stuff if you want. Just got to shoot me an email. I'll give you that here before we conclude tonight. So MSM, that's another one that's really good for pain. Magnesium, this is really good if you feel like a lot of your pain is coming from muscle tightness, like just really intense tightness and stiffness. Again, because magnesium is basically the body's natural muscle relaxer. And so magnesium, I'll tell you, a brand that I've really come to like for the magnesium is a company called Nordic Naturals. And there are some magnesium gummies. And no, these are not the marijuana gummies. It's just got magnesium. So you can take that, and that really works really well, I found. And little bonus tip for those of you guys that use magnesium is if you take your magnesium before bed, it also helps you get a really good night's sleep too. Okay. So just because of that muscle relaxation effect. Green-lipped mussels. So this is, I was not familiar with this one until a year or two ago, but this has kind of been the new thing with a natural painkiller. So this is something, and primarily its effect is that of an anti-inflammatory. So green-lipped mussels, they're starting to incorporate this in some of the compounded pain relief formulations in like the holistic world, so the world I live in. And that is something they're starting to use. So green-lipped mussel, it's another one. You can search that and find some good information. This one here, willow bark, I really, really, really like. So basically, willow bark, particularly the stems of the willow bark tree, is basically a natural aspirin. So this works in two ways. So basically, anti-inflammatory effect again, but if you're somebody that was looking for like a natural blood thinner, so maybe you have some kind of mild condition, maybe you're at a slight increased risk of stroke compared to the average population, maybe your doctor is recommending that you take like a baby aspirin every single day. Well, if that's all they're recommending, you could very easily get away with a willow bark stem, okay? And it's like in a capsule they just take. You just have to make sure that the brand of willow bark that you're getting has been compounded from stems. So just the stems of the willow bark. So you just look in the ingredients and it should say willow bark stems. If it doesn't say that, then it's probably not going to be very effective. So that is something that has been a game changer. Fish oil, all of us have heard about, hey, fish oil just in general is really good for you, but it's also fantastic for eliminating pain, and primarily because it's very rich in omega-3s, which is good, a good natural anti-inflammatory. A quick story about the power of fish oil. I really like, out of all the fish oil types, I love a liquid cod liver oil, right? I love the brand Carlson's cod liver oil. Now, you can get this on Amazon. You can get it at Whole Foods where I prefer to get it. Let me tell you, this is getting really, really expensive. I think I just paid $50. I hate to, it's like double the cost for a bottle that's not even that big, but I buy it because I don't even take it for myself. Okay, I give it to my dog, and here's why. And I'm not a veterinarian by any means, but if your dog is having any kind of like I call it part of the old dog syndrome, like really stiff, arthritis in their joints or hips, for people too, this works for people too, but he tore his ACL, which I guess in dogs it's actually called a CCL, and they were wanting to do surgery, and they were very adamant about that. And I was like, he was still really young. He was like 2 or 3 years old, and I thought, well, maybe I was like, let me just see, let me just see what I can do on my own. And this was a big thing for him. It really, really helped with that, and just using the laser at our office. And of course, I'm mommy chiropractor, so I'm adjusting him for sure. But within 2 weeks, he was good, and we never had to get that surgery, knock on wood. And he's 9 years old now. So the cod liver oil, very powerful effects. It's great for your cardiovascular health. Very, very good for keeping down inflammation. So if you've got arthritis or any kind of joint issue, it's really, really good. One thing too that you can add to all of this, and there's some supplements out there that have a mixture of all of this together. I'm a big fan of those because they all kind of have their thing that they're good at, or that some is better than others. But when you put them all together, you kind of have the big spectrum of everything. But collagen, especially if you've got a joint, diagnosed joint issues. So things like osteoarthritis, or, you've got osteoarthritis in your knees or your shoulders. It's really, really good. Also, once you get older, collagen is really good for just, anti-aging effect, your skin, that kind of stuff. So these are really good. So again, just take a screenshot, write these down, whatever you need to do to make sure that you can kind of refer back to them a bit later. Because I always, 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 if I'm having any kind of health problem, from anything, but especially something like pain, I always try the natural stuff first. I mean, I get adjusted. I do the cupping, the laser, the soft wave stem cell, whatever I got to do, just like we recommend. That is always my first go-to. And 85% of the time, it solves my problem. But I always like to add these things in there too, just to help support my body. And I will exhaust all of the natural options first before I think about taking a medication, just because I just don't want it in my body. Okay, so something that's really cool about what you guys just learned. So there was a really big study done back in 2002 to the American Journal of Clinical Nutrition. And what they found was that several investigators have reported that rheumatoid arthritis patients, so this is an autoimmune arthritic condition, when they consumed omega-3 dietary supplements, so something like a cod liver oil, they were able to lower or discontinue their background doses of NSAID drugs or disease-modifying anti-rheumatic drugs. So, interpretation. These patients took some of the things that I just mentioned to you, things like cod liver oil. You can also take any kind of other fish oil that's got EPA, DHA, tuna omega oil, those types of things. Taking those things in the proper amount, they were able to completely stop the use of their NSAID drugs, and in some cases also their RA drugs, or the anti-rheumatic drugs. That is a huge success study. And so again, if somebody with RA can eliminate their pain with fish oil, you can too. Now, in 2010, there was another study from the Clinical Journal of Pain, and they found they were working with different conditions. So the diagnosis included a variety of things like cervical radiculopathy, this is pain in your neck that shoots down into your arm, thoracic outlet syndromes, a similar type of symptoms, fibromyalgia, carpal tunnel syndrome, and a burn injury, so people that have been severely burned. The doctors reported significant improvement, not just on the patient's pain scale, so decrease in pain, but also on objective measures such as grip strength and EMG nerve conduction studies, which basically means that they got stronger and their nerves actually healed, which they tell you that once you damage a nerve, you can never heal it back. So that is an incorrect statement, and maybe it's just something that they didn't know, right? They just truly didn't know. But now, as we're learning and doing more studies, the research is there that the nerve can repair to some degree, but you just have to give it back what it needs and what it's missing. So I'm hoping that this is making sense. because these can be extremely valuable tools once you know how to learn them. So learning to know, hey, if you absolutely have to take medication, which sometimes we do, right? That's just life. I know I've had to take my fair share, over the years from having surgeries and sometimes getting stricken with pain. But I know if I ever have to do that, I'm gonna go through that drug chart. I'm gonna see what nutrient it's stripping out. I'm gonna go ahead and put myself on those supplements for the duration of me being on that medication. And that way I'm not having those ripple effects or more downstream problems later on. The other thing too, is if you have to use some kind of medication, let's say medication, that you try the natural stuff first. And then if for some reason that's not working, then you use the medication as the last resort, right? But more importantly, like, let's figure out what actually causes chronic pain. And so when I say chronic pain, this is a pain that's just been maybe off and on for years. And most people, unfortunately, I found is, and myself included, is that they have some kind of thing with them. Everybody has a thing. That person has asthma, this person has allergies, this person has migraine headaches, this person's got rheumatoid arthritis, right? Unfortunately, we're not always perfect. So the question is why? Like, why are these things happening? So number one cause, let's go through the top causes of chronic pain. I'm going to go through the top ones first, and then there'll be some secondary ones or less common, but also ones that we equally need to pay attention to as we go down. So subluxation. So just to remind you guys, subluxation, all this is, it's a simple concept, but its effects can be very, very powerful. Bones in your spine should have a certain alignment. When they shift out of alignment, they can't move, they don't stick in you get constant pressure on those nerves. They also don't allow the nerve to fire correctly. And now wherever those nerves are plugged into, we're going to have an issue. The longer that subluxation is there, that misalignment, it's going to rub and wear on that joint. It's also going to fire something called nociceptors, which are those pain receptors. And so that sometimes takes some time to happen, but that is the number one cause of chronic pain syndromes I've seen in patients. The other thing is dehydration. So if your body doesn't have enough water, then you're going to have chronic pain. That's just the way it is. And there's a couple of reasons for this, but your joints need to be lubricated. Your muscles are mostly water. When those things are dehydrated, then they're just going to grind and wear and tear much easily, a lot more tension and strain that way. Also, there's a lot of toxins in our environment. So things like the medications that you're taking, the cosmetics you're placing on your body that get absorbed in your bloodstream, the processed foods that you may be eating on a daily basis because you eat out or you're eating prepackaged stuff. And so if we don't have a lot of water to flush that stuff out of our system, it's going to sit in our joints and cause erosion. So pain, sedentary lifestyle, or what I like to call exercise deficiency. So I studied a lot about genetics when I was an undergraduate student. I was a pre-med student at the University of South Alabama. And I actually worked in like a genetics research lab. I did that as part of the work study program as a student. And one of the things that I noticed was that when you look at your DNA, there's literally a blueprint inside there that talks about that basically gives instructions for what your body needs as far as nutrients and just everything to be healthy. And so exercise is something just that you need. And think of exercise, your body's requirement for that is like a vitamin. So just like vitamin exercise. So it looks like you need a certain amount of vitamin C and vitamin D. You need a certain amount of exercise. And if you're not getting enough and you have a deficiency, you're going to have some problems. So your joints are designed to move. Your body's designed to move. The less active you are, the more pain you're going to have. And so that's a conversation that I have, with new patients all the time. And it's like, I don't know why, Dr. Rachel, I don't know why I have all this pain. I don't even do anything. Well, that's probably why, right? Or sleep. So sleep is not a luxury. It's a necessity. And this is where you do, I think they say from about 10 p.m. to 2 a.m., their body does a lot of the repairs. So, life is stressful. It takes its toll on your body from physical stuff to emotional stuff. And sleep is when all those repairs happen. And if you're not getting good quality sleep, then the repairs can't happen. So you stay in this constant breakdown process with your body deteriorating, and that's painful. Okay, so this is a big thing. And I always say you can't heal until we start to get you sleeping well. So these next things that I'm going to go through are, in my opinion, less common from what I've seen in practice in the last 17 years as far as causes of pain. However, they are becoming a lot more common and we got to pay attention to them. So underlying infections, particularly in your gastrointestinal system. So how in the world would something like this cause pain? There are a lot more chronic gut infections that I'm finding, and that primarily, there's some parasites in there, or even overgrowth of certain bacteria. It's causing damage to the gut, leaking out in the bloodstream. That will start to erode your joints. So there's that. And how do you know if you've got something like that? Testing. Testing. So things like there's something called a gastrointestinal map. It's actually a test that we have at the office. And so for those of you guys that have more questions about that, feel free to ask me on your next appointments, or you can just shoot me an email. But that's something that I've had to address with a lot of patients over the years. Toxicity. So again, if you're eating a lot of processed foods, you take quite a bit of medications, you use a lot of cosmetics, makeup, perfumes, that stuff. It gets into your bloodstream. It's very toxic on the body, and your liver is basically the main filter. It's filtering out all these chemicals, the toxicity. If you consume a lot of plastics, there's toxicity in that. So your liver's in charge of filtering that stuff out so that as to protect it from getting inside your body. But the problem is liver in most people is very overwhelmed nowadays. And so then the toxic stuff just keeps recirculating into the bloodstream, and that's very inflammatory to the body. It's also going to make you start packing on quite a bit of fat. Nutrient deficiency. So again, if you're just deficient in certain nutrients, you're going to have pain. So like if you don't have enough omega-3 fatty acids, where we get from like fishes and olive oil and things like that, you're going to have pain. If you don't have enough magnesium in your body, you're going to get a lot of muscle tension, cramping, you're going to have pain. And vitamin D, if you don't have enough of that, you're going to have pain, right? And so these are a lot of things, and most people have multiple of these factors going on simultaneously. So no wonder they just stay in this chronic state of pain, and all that ever gets offered to them is, well, maybe you can try 1,000 milligrams of ibuprofen, or maybe we can get you on hydrocodone and these other narcotics, right? So be careful with that. Stress. So stress will create a lot of tension in your body, but it also creates a chronic inflammatory state. It actually changes your physiology. It exhausts your adrenal glands, and then cortisol starts spiking, and it's a constant cycle of issues downstream. So I know stress is not always unavoidable, but some of it is. So just start focusing on what you can change, cut it out. I mean, I've had people where their job was literally so stressful, it was killing them. I mean, it's constant. And, this ultimately, in some cases, what we've been able to figure out was been their very source of pain was this just chronic, constant stress. And so if this is you, the one thing that helps is changing jobs. And I know, depending on where you're at in your career, it's like the last thing you want to do. But it's worth getting your health back, because if you don't, this is exactly what leads to chronic depression, or worse, things like cancer, heart attacks. There is no amount, to me, that is the most stressful thing, is when we lose our health. So make sure that you tend to it. Don't brush it aside. Don't bury it under. Talk about it with your spouse. Talk about it with your family, maybe even other coworkers that maybe can share in that despair, and talk to them about, you got to make a change, right? Something's got to change. Another huge one, food sensitivities. So this one is huge. We address this a lot with our patients also on our weight loss program. So here's the thing with food sensitivities. There are certain foods that you may be eating. Now, this is not food allergies, by the way. This is totally different. Food sensitivities, basically your body's creating an immune response here with certain foods that you're eating. So, and that in turn creates inflammation in the body, i.e. pain. So food sensitivities, for example, I always, if we ever have some kind of new test in the office, or I recommend anything for a patient, for the most part, you can rest assured I've done it to myself. And so before we started offering food sensitivities in our office, the testing anyways, I ran a panel on myself. And what I realized was, I couldn't, for me, pineapple was on my list. And then also, what was the other one? Dairy, which I tried to stay away from anyways. But, once you identify sensitivity, the plan of action is now to completely eliminate it for anywhere between 3 and 9 months, depending on what grade of severity you are. And I tell you what, once I got the pineapple out of my diet and which I was eating a lot of, and the dairy, 100%, I noticed that my neck, which has always been my main issue, was a lot less inflamed just because of the food stuff. So it's stuff you never would have thought about. Leaky gut. So this is actually where you get, sometimes it comes from chronic food sensitivities or it comes from underlying infection, but usually what jumpstarts all of that to cause damage, to create a leaky gut situation. By the way, leaky gut's when you get damage to your intestinal cells. And so your intestinal cells should lock together like this, right? There shouldn't be any gapping in between. Sometimes when we take like a heavy round of antibiotics, or sometimes just any kind of round of antibiotics, it can cause a break in the intestinal cells. And so now there's this gap in the contents of your intestines, i.e. your bowel, now leaks out of this space into your bloodstream where it should never be. And that starts creating autoimmune responses. In my opinion, is what leads to chronic, it leads to autoimmune disease, that and some certain vaccines. And what happens is it creates a chronic erosive environment and it attacks your joints and it's pain, okay? Hormonal imbalances. So especially with us women, we're a little more sensitive to that since we have a thing called menopause or even perimenopause leading up to that. So when your hormone levels drop, the whole body becomes inflamed. Not fun, right? So how do you address that? For example, if you're somebody that's perimenopausal or even into menopause, and so like your estrogen and progesterone are pretty much non-existent, it does create more joint pain and stiffness, some patients more than others. But, I'm not a big fan, and I'll go ahead and tell you, of that hormone replacement therapy or HRT, primarily because it's synthetic chemicals, even if you're on bioidenticals, your body handles them much better than the synthetic stuff, but it's still not natural. I have to tell you that, okay? And with that being said, it can help your symptoms a bit, but you're still at an increased risk of breast and ovarian cancer downstream, which they don't tell you about. So what I would rather deal with is let's talk about what your main symptom is because of this phase of your life, and then come up with more of a holistic treatment protocol to address those symptoms and then just make it a lot more manageable for you. So hormonal imbalances, that's a real thing, guys. Low testosterone can lead to that also. And of course, I put subluxation on here one more time because it's so important. Arthritis. So this is something, wear and tear of the joints. So when the joints start to deteriorate, it can be in any joint in your body. This is a possibility, whether it's your shoulder, your hip, your knees, your spine for sure. Basically just means when the joint tissue, the spacing starts to deteriorate, so we start to get more of this rubbing and wearing effect, then that can happen. Really, the name arthritis just means, inflammation of a joint, but most in the medical world are using it when they start to see the joint actually starting to deteriorate. That's how they use it in medical practice anyways. So usually you just got to make sure, so that's the result. But at least with chiropractic care, if you're doing things to structurally repair and maintain the integrity of the joint, like in other words, as soon as we get the joint in normal alignment, it can now move better, and that immediately puts the brakes and slows down that wear and tear effect. The other thing is taking anti-inflammatories, right? Like cod liver oil, fresh, some good quality fish oil. That'll keep the inflammation down low. And then if you do some strengthening exercises around these weak joints or the joints that are deteriorating, you offer more support to the joint and then less pain. So I like that multifaceted approach when taking care of things like arthritis or the other stuff. Rarely is there just this one, magic bullet that solves all your stuff. So as you can see, there are a lot of causes of pain. Chronic pain, which is typically what we see. And you have to just be mindful that it's not just a lack of medication in your body, lack of pain medication that causes pain. So don't rely on pain medications to resolve your pain issue. It never will, ever, ever, ever. However, you know, if you just need to get your sanity back that day on occasion, that's what those things are for. Okay. Now, I'm not saying go home right now and stop all of your pain medication. I'm not saying that at all. That's only something that, you know, that's a conversation you need to, you know, if that's your desire, that's a conversation that you and your medical doctor need to have. And I'm not, it's not within my scope to talk to you about, you know, stopping your medications. However, we can give you the things that the tools that you need to naturally eliminate the pain, and therefore have that conversation with your doctor about maybe tapering you down on some of the medications, or maybe in some cases, I found a lot of patients are able to come off all that altogether. So another thing that's really good for pain, and I know I talked about, you know, quite a bit about the different conditions and the causes and things that you can do holistically. But there's something now for those more advanced joint conditions. So if there is truly arthritis, like any type of joint damage taking place, especially if it's like a shoulder, an elbow, a knee, a hip, or a foot. And then we can use this is also available for spine stuff too. But as a chiropractor, a lot of times we just assume that's a given. So I just want to let you know there's other things, you know, all the other joints are available to treat also in our office. So there's something called stem cell therapy. So many of you guys may have heard of this before. It's been, you know, they talked about this years ago. Stem cells are basically just those virgin blood cells that have the ability to become any kind of other tissue. And so you can make anything brand new, essentially. So there's something called stem cell injections that you can get. The problem is they're super expensive and could be up to $4,000 per joint. They usually require multiple treatments. And the thing is like a lot of times with stem cells, they aren't, you know, when you're doing these injectables, they're not specific to the joint. So while they can be effective, they're super expensive. That will help repair the joint tissue to some degree, but they aren't really specific to the joint. So what we have decided to bring into our office, which I have found extremely effective, is something, so it's in the scope of tissue regenerative therapy. It is the most up and coming. It's been around for probably 10 plus years, but specifically there's something called a stem cell machine, which is non-invasive through a company called Softwave. So this was actually featured, this technology was featured on the show called The Doctors. If you guys want to look it up, you can go to softwavetherapy.com, or you can even go to YouTube and search Softwave on The Doctors, and you can watch that episode where they interview a specialist talking about how effective it's been. So with Softwave therapy, basically what this is a non-invasive way to use mild sound wave in the form of shock wave directed specifically at whatever joint is proven to be the problem for you. What that will do is stimulate your body to recruit its own natural stem cells to the area, wakes up dormant stem cells, let's say, so that your body then can use its own tissue to repair itself and its own bodily processes. So it's very, very, very effective. Another bonus is that it's non-invasive. The stem cells that are recruited in that area are specific for that joint. So when you're doing the therapy here, your body is only going to recruit shoulder type stem cells. Whereas if you were doing the injectables, what they do is they'll draw your blood, they'll spin it around in a centrifuge, condense the stuff there, and they'll re-inject your own stem cells into your joint. But that's just general blood, not specific to any particular joint. Whereas the Softwave, this stem cell machine, non-invasive, it just kind of looks like an ultrasound head that uses mild shock wave at this area. And it's specifically like if we were treating my shoulder, for example, because it had some arthritis or it had some cartilage or some other kind of muscle damage, tendinous damage, by providing that therapy right there, it would help my body recruit its own dormant, specifically shoulder stem cells, which is a huge difference with getting a better result. So specifically what we're liking in our office is any kind of arthritis. We've been really successful with treating plantar fasciitis, resolved really quick, in-tip and neuropathy, shoulder pain, foot pain, pain in the hip and elbow, also very, very effective. So this particular therapy is actually now available at our office, and we've had some extreme success. I can't wait to where we're actually in the process now of getting the testimonials posted to our website. And they've just been incredible with the results that we've seen. We've seen people with, gosh, plantar fasciitis. Everybody's how many treatments they're going to need is everything is going to be varied depending on the case and depending on the patient, of course. But I know that most, just to give you an idea, plantar fasciitis cases respond really well in about 3 treatments. If it's a true case of plantar fasciitis, any kind of tendonitis. So if you're somebody that's suffering from chronic like elbow pain, especially like a golfer's elbow or tennis elbow, game changer, this therapy here. Also, knee pain, I found it to be extremely helpful in shoulder pain. So again, we can use this on the neck and the back. I found that with chiropractic and the soft tissue work that we do there, that's been plenty enough, and patients don't even really need to go to the soft wave, but we do have some cases where they've needed this next level care for that. So this is actually FDA approved, and this is something that these German orthopedic surgeons started in Europe, and they have gotten incredible results. Our staff is always involved in the training with them, and they have been a godsend as far as just making sure that our staff is trained appropriately and we're getting the exact results. And the cool thing is, if we ever get some kind of weird patient case, and when I say weird, I mean a condition we haven't seen before, which is rare nowadays since we've been in business for 17 years treating patients. Every now and then you get this kind of unicorn, right? And so, but we can always get on the phone with one of these German surgeons and just say, hey, what's the protocol here? Which has been really amazing. So the typical soft wave treatment is $150, way better than the $4,000 stem cell injection, which, by the way, isn't nearly as effective. We found that, as the soft wave machine here. So what we're doing now for everybody that's on here tonight is giving you guys a unique opportunity in that you can get your first session for only $49. So we only have so many appointments available for this. We've got 2 of our team, well, 4, including myself and Dr. Travis, but 2 that are available technicians to provide the therapy. So the first session, this intro rate of $49, what it really is it's something called a mapping session. So not everybody is a candidate for this. I'll tell you that right away. But we won't know until we do this mapping session. And this is where we take a good detailed history. We talk about any type of accidents or traumas that have happened to the area, get a better idea of what's going on there. Also, at that point in time, we'll get some details about specifically the pain and the symptoms there. And then they will do what we call a mapping session. So this is going around specific points, inducing some of the shockwave there and we're looking for a certain response with that. So as long as your body has painful spots in the certain areas, then we'll know for sure if you're a candidate or not. If you're not a candidate, we'll tell you right away. If you are a candidate, we'll tell you that, of course, and we'll go through exactly what we recommend as far as the treatment goes. But I felt like there was a little bit of a gap between, 85% of our patients respond extremely well to the chiropractic, the soft tissue work, and some of the nutrition that we recommend for our patient. But then there was that 10 to 15% that really just had such advanced joint deterioration or inflammation within the tendons, things like a really wicked case of tendonitis, that just we needed something more, but we didn't really have any other options outside of sending them out to pain management for a steroid shot or something. But unfortunately, the effects would wane, and it wasn't like a long-term solution for that. This is a repair process. This is the long-term solution that we've been looking for. So I thank you so much for everybody being on here tonight. As far as so first of all, an email. If you guys have any questions, here's my email. It's Dr. Rachel at the Hutch Chiro, and that's DrRachel at thehutchchiro.com. So shoot me an email with any questions that you have. For those of you that want to get the $49 intro special done with the soft wave, what I want you to do is you just call the office. So that's 243-2723. And we do have patients coming from non-local areas to have this done. So if you're not local, our area code is 850. So 850-243-2723. If you're a patient and you're used to texting us and getting the text from us, you can always just text the girls at the front desk, Danielle or Jasmine, and say, hey, sign me up for that $49. Do that. So I believe we have like 15 appointments that we can take for this, just because we've got, it's just, we only have so many appointments because we're so busy on the chiropractic end, but this is so valuable that, I mean, I just wouldn't sleep well if we weren't offering this to as many patients as we could. So I thank you so much for being on. We'll see you guys on the next one. And stay tuned. For those of you guys that don't follow us on Facebook yet, make sure you go on there tonight and you click a follow, because you'll be up to speed on other health classes that we're going to be doing like this. Plus, my staff and I, we do our best to try to entertain you with ridiculous pictures and videos. So if you guys didn't catch our dance video special, you might want to go back and check that out from the first week in March, I think. I use the term dance lightly. Okay, guys, had a great time. We'll see you on the next one.